Today, we're going to track a silent traveler inside the human body, a kind of rogue agent that can cause a massive medical emergency in a split second. We're talking about a pulmonary embolism. We're going to break down how it happens, who's at risk, and most importantly, how we can fight back.
Just look at this number for a second. 100,000. That's the estimated number of people in the United States who die from a pulmonary embolism every single year. It is a huge, staggering number, especially for something that, in many cases, is actually preventable.
So, what is this thing? What exactly are we talking about? Well, a pulmonary embolism, or PE for short, is basically a traffic jam in your lungs. Usually, a blood clot that forms somewhere else in your body breaks free, travels through your bloodstream, and then gets wedged in one of the arteries in your lungs, creating a really dangerous blockage.
And, this isn't some super rare thing. In fact, PE is the most common cause of preventable death for people who are in the hospital. We call it a silent threat, because where it starts often goes completely unnoticed, until, of course, the crisis hits.
So to really understand this lung emergency, we have to start somewhere else entirely. The origin story for most PEs actually begins way down in the legs, deep inside the veins, with a thing called a deep vein thrombosis, or DVT.
All right, so this brings us to the journey itself. How does a problem in your leg become this massive, full-blown crisis in your chest? Well, it's a four-step process, really, that turns a clot that's just sitting there into a mobile and very dangerous threat. So it all starts with that DVT forming, usually in a leg vein. Then a little piece of it breaks off, and now it has a new name, an embolus. This thing is now on the move. It hitches a ride in your bloodstream, on a direct highway up through the heart and straight into the lungs. And the journey ends when it gets stuck in one of those pulmonary arteries, creating that critical blockage we talked about. So what creates the right conditions for that initial clot to even form? You can think of it like a perfect storm. It's usually a combination of factors. Things like not moving for a long time. Say you're recovering from surgery or you're on a long flight, or maybe an injury to a vein. Certain conditions can also make your blood clot more easily. And of course, things like age, obesity, and smoking are also major risk factors that help set the stage.
Now we get to the climax of this whole journey. What happens at the exact moment that rogue clot arrives in the lungs? Because this is where the life-threatening part of the story really begins.
Here's the core of the problem. It creates a roadblock effect. Your lungs are doing their job, they're breathing in air just fine. That's the ventilation part. But the blood flow, the perfusion, is blocked. So imagine a busy highway where all the cars are suddenly blocked from getting to the gas station. The fuel, the oxygen, is there, but the blood just can't get to it to pick it up. This mismatch is what causes the crisis.
So with all this chaos happening inside your body, how would you actually know if you or someone near you was having a pulmonary embolism? The signs can come on fast, and frankly, they can be terrifying. And it is so crucial to recognize these red alerts. The classic sign is a sudden, out-of-nowhere difficulty breathing. That's often paired with a sharp, stabbing kind of chest pain, and this profound feeling of anxiety, like a sense of impending doom. And also, look out for a dangerously fast heart rate, what doctors call tachycardia.
Okay, so recognizing the symptoms is step one. But for doctors, confirming a PE takes some serious medical detective work. They've got to piece together all the clues to find this hidden danger.
One of the first tools they'll use is a scoring system, like the Wells criteria here. So instead of just guessing, they add up points based on risk factors and symptoms. You can see things like a fast heart rate or recent surgery, and that helps them calculate the mathematical probability of a PE. A high score tells them they need to move fast and get more definitive tests.
And the gold standard, the test that gives them the final answer, is a special kind of CT scan called a CTPA. It uses a contrast dye that literally lights up the pulmonary arteries, giving doctors a clear, undeniable picture of the clot and exactly where it is.
So, once the enemy is identified, it's time to fight back. And medical intervention for a PE has two main goals. First, you got to stop the situation from getting any worse. And second, you have to deal with the clot that's already causing all the trouble.
The main weapon here is a two-pronged drug attack. On one side, you've got anticoagulants. You probably know them as blood thinners. Think of these as the peacekeepers. Their job is to prevent any new clots from forming and to keep the current one from getting any bigger. Then, for more serious cases, you've got the fibrinolytics. These are the demolition crew. These are the powerful clot-busting drugs that go in and actively dissolve the blockage.
Now, in the most critical life or death situations, doctors might need more invasive options. A surgical embolectomy is literally when they go in and physically remove the clot.
Catheter-directed therapy snakes a tiny tube right to the clot to deliver those clot-busting drugs with pinpoint accuracy. And for some high-risk patients, an IVC filter can be placed to act like a safety net, catching any future clots before they can ever reach the lungs.
So after the immediate crisis is over, the focus totally shifts to prevention. And this is where everybody has a role to play. Because really, the best way to survive a PE is to never have one in the first place.
And what's really powerful here is just how simple and effective these preventative steps are. The name of the game is promoting blood flow. Getting up and walking around after surgery is so important. But even little things like not crossing your legs for hours on end or not sticking pillows right under your knees can make a huge difference.
And this totally applies to everyday life, especially when you're traveling. If you're going to be on a long flight or a long car ride, the advice is crystal clear. Get up and move around every couple of hours. Drink plenty of water. Even just doing simple calf exercises in your seat can keep that blood flowing and seriously reduce your risk.
So the next time you're settling in for a long trip, maybe think about that other journey, the one a rogue clot could take. We've seen how this silent threat can turn into a major crisis in an instant. The only real question left is, what simple step are you going to take to stop that journey before it ever even begins?